Hello, myself Salvina. Welcome to Nursing Guru. So today I am going to teach about diabetes mellitus. Diabetes mellitus definition is it is a disease condition which a person's body cannot control the level of sugar in the blood. Here is 4 types is there in diabetes mellitus. One is type 1, one is type 2, one is pre-diabetes, one is gestational diabetes. So I am going to type 1 diabetes. It is a chronic condition where pancreas are not produce little or no insulin. Then type 2 diabetes. It is a chronic condition in which our body sugar level is increased. Now pre-diabetes. It is also a condition in which blood sugar is in high but not high enough to type 2. Now is gestational diabetes. It is a type developing in some people during pregnancy. So now I am moving to cause. In diabetes, overweight, obesity, physical inactivity, unhealthy diet. Now I am moving to risk factor. Risk factor is overweight, 45 years old, family history, smoking, drinking alcohol, behavioral habits. Now I am moving to signs and symptoms of diabetes. In here, feeling thirsty, lost weight without taking food, very feeling hungry, having numbness, feeling tired. Now I am moving to best management of diabetes mellitus. Taking protein-rich diet, sleeping pattern should proper 8 to 7 hours, reduce drinking alcohol, reduce to smoke, eat more water, vegetables items, minerals. So now I am going to teach what are the treatments are there. In this, we can use insulin pump, diuretics, weight loss surgery, insulin therapy, that's all. Now I am coming to nursing diagnosis. In this, knowledge deficit is there, risks for infection, risks for injury and deficit and knowledge. Now I am talking about complications of diabetics. Diabetics neuropathy, diabetic retinopathy and chronic kidney disease is there. Heart attack can happen. Hope you all like this video. I discussed diabetes mellitus. If you have any doubt regarding diabetes mellitus, you can comment in comment section. Please subscribe our channel, do like, click the bell icon and share it.